This is a presentation on applying trauma-focused CBT for survivors of trauma and sexual abuse. My name is Sheryll Coulter, and I will start with a brief history of trauma-focused CBT. Aaron Beck refined cognitive and behavioral therapeutic strategies into what is now called CBT, and it is particularly effective for depression, anxiety, obsessive-compulsive disorder, and panic disorder. It has also been found to be effective for adults suffering from trauma or PTSD. It was subsequently used for children experiencing trauma. In 2000, Cohen, Marinaro, Berlinger, and Deblinger conducted meta-research on the use of CBT for children and adolescents who had experienced trauma. They found empirical support for the practice of CBT with that population. Cohen, Marinaro, and Deblinger used the research to tweak the model to make it more useful for children. For example, kids tend to self-blame regarding the cause of the trauma more than adults, so cognitive processing should be emphasized more for kids. Another insight from the meta-research is that most kids benefit less from the trauma narrative than adults do, so less emphasis is put on that step for children. Cohen, Marinaro, and Deblinger called their new model TF-CBT. By the way, the term trauma-focused CBT had been used informally before, but it became the moniker for the CBT modification developed specifically for children who had experienced trauma and sexual abuse. It is now used for children and adults who have experienced any kind of trauma. For our population, though, we chose children aged 3 to 18 years old who have experienced sexual trauma. Now, Jessica Cooper will talk about the process for using trauma-focused CBT.
So we're going to go real in-depth into this process. One of the main things to think about, first of all, with trauma-focused CBT is that it really involves the family and the caregivers specifically. So each of these steps is going to be used with the child, but also with the parent in some way. So these steps can be broken down using the acronym PRACTICE, and we're going to go through each of these individually. So let's start with psychoeducation. So in psychoeducation, you're working with children who have experienced sexual abuse in this case. And a lot of times children who have experienced this are often confused about their experiences. And this leads to a lot of false information, incorrect information, and thought processes surrounding their abuse and trauma. And this can lead to children blaming themselves for their trauma, saying that it's my fault that this happened to me. It's my fault that whatever traumatic event or abuse that happened, that they can begin to blame themselves for it. So in psychoeducation, we're clarifying this false information. We are normalizing thoughts and fears, correcting false information, and we're also asking questions from the child to gain a baseline of what they understand. So we're asking the child questions like, what do you think sexual abuse is? How often do you think this happens to kids? And we're hearing that information that they're giving us back. We're hearing the ideas and thoughts that they have surrounding this experience that they have. And we're providing the correct information for them. So if they give a response that involves blame of themselves, then we're saying, actually, this is a pretty common thing that happens. It's very bad and it's a very terrible experience, but it's not your fault. And these are kind of the things surrounding it, and this also leads to gradual exposure. So basically, we're just giving kids language to talk about a very difficult experience. And we're not only giving them permission to do this, but we're giving them a safe environment where they can talk about these things that they might not even feel comfortable talking about with their parents. And moving on to the next step in trauma-focused CBT is the parenting skills. So here we're going to incorporate the parents, and a lot of times when a child has experienced trauma, in this case, sexual abuse or trauma, they start to show negative behaviors in the house, aggressive behaviors, things like that. And in this stage, the therapist is teaching the caregiver skills that they need to address these negative behaviors in the home from a trauma-focused perspective. So this means that instead, you're basically reframing the parent's idea of using this quote here. Is your child a bad child, or are they behaving like a child who had something bad happen to them? So we're teaching parents how to stop using unhealthy discipline strategies, how to use praise correctly, the importance of consistency, and how to practice these skills in the home. And overall, this stage should result in the parents having a toolkit of skills that they can apply in the house to figure out what best applies to their child and their situation. And then moving forward, we're going to start with these next 3 steps. I think all kind of go together in some ways. So the first is relaxation. In this stage, we are looking at addressing the physiological symptoms of fear and anxiety. So talking with the child about when you're feeling this way, sometimes it can become hard to breathe. Sometimes it can, whatever like physical symptoms the child is experiencing surrounding triggers or these emotions related to their trauma, we can teach them relaxation techniques, focused and controlled breathing, progressive muscle relaxation, mindfulness, things like that. And what this leads to is the child begins to feel like they have a sense of control over their own body. So they can gain confidence in this, that even though they have these big negative emotions, hey, now I know that this exercise that I can use when I'm feeling this, and I know that it's going to at least calm down my body. So it gives them that sense of control. The next step is affect identification and regulation. And in this step, the child is learning to identify and put names to their thoughts and feelings. So a lot of times, a child is going to be experiencing intense feelings related to their trauma that they don't understand. They don't know how to address them. They don't know how to regulate them. And here the therapist is going to focus on helping the child recognize those feelings and learning the skills they need to regulate them. And you're also going to be teaching these skills to caregivers, because parents are also having a lot of huge emotions related to the trauma that their child has experienced. And you're also helping the caregiver walk through those. So here we're learning how to understand healthy emotional expression versus unhealthy, understanding the causes and consequences of emotions, and learning how to practice appropriate ways of expressing feelings. And then finally, we're about halfway through the practice acronym now, onto cognitive coping. So here it kind of brings together the identifying our thoughts and feelings, and we're using the cognitive triangle, and we are looking at the connection between the thoughts, feelings, and behaviors, how our thoughts create feelings, which create behaviors. And if you change your thoughts, you can, in effect, change your behaviors. So here, the child and caregivers are taught to recognize and challenge unhealthy, untrue, and unhelpful thought patterns, and replace them with more positive ones that can just lead to more positive and functional feelings and behavior. So in this stage, you're basically challenging thought processes that are negative and replacing them with positive ones. This next section is very important to the TF-CBT therapeutic approach. It's called trauma narration and processing. So in this step, the child is putting specific language to the trauma event or events that they've experienced. And this is in the form of some sort of developmentally appropriate format, like a book or drawings or things that basically the child has to walk through every specific detail of their traumatic experience and like put it down on paper, which is a very intense experience. It happens over many sessions. It's not something that happens all at once, especially for younger kids. This is something that's very spanned out over many sessions. And what it does is it helps the child approach rather than avoid the negative experiences. And overall, it helps to reduce the overwhelming emotions associated with the traumatic event. After this, we're looking at in vivo mastery. So in this step, the goal is for the child to master their fears and learn to function even when they're near very triggering locations, situations, even objects, smells, things like that. So this is also something that can span over many sessions, but in the very safe environment of the therapist's office, the child is going to be brought closer and closer to whatever has triggered them in some way, whether, like I said, whether that's a smell, place, something like that. They'll be brought as close as possible to that trigger, and then using the coping skills that they've learned in previous sessions, they'll learn how to approach those triggers and regulate the emotions that they feel surrounding them so that they can function even in the presence of those things. In the next step, this is conjoint parent-child sessions. So the parent or caregiver is a part of the entire process, but specifically in these sessions, they will happen with the parent and child both in the same room, and the child is sharing the trauma narrative. So this is kind of the make or break point of the therapeutic process where the child is able to fully share their experience with their parent or caregiver. And the caregiver ideally is going to respond in a way that is positive and encouraging for the child and is shown to be a very stable force in the child's life. So it is imperative that before these sessions happen, the parent or caregiver is coached through their response to the narrative, because it is way more important for the child to receive a positive response from the parent than for the parent to be able to express all of their emotions surrounding this trauma, right? So it's very important that you role play with the caregiver hearing the trauma narrative. You're showing them exactly what not to do and replacing it with the best possible response. So the child is being very open and vulnerable with the parent, and the parent is shown and kind of coached through responding in a way that shows wow, thank you so much. This took a lot of strength to share with me. I can see that I really, just appreciate you sharing this with me, those types of things. And then finally, the very last step is enhancing safety and future development. And in this stage, basically the whole goal here is to reduce the risk of future victimization. So here the child now understands that they're not to blame for the sexual abuse, for the traumatic events that they've experienced, and they're able to learn about recognizing potentially dangerous situations, people, things like that, and what to do in those situations. So we're role-playing safety plans that have been created with the caregivers, learning about assertiveness and confident body language, saying no, I don't want this in some senses, and then removing themselves and finding a safe adult, things like that. So overall, it's like a summary of the process of trauma-focused CBT. And now I'm going to turn it over to Damon to talk about the benefits of using this approach.
As it is stated previously, this is a very imperative process within the social work profession, especially with children who have experienced sexual trauma. In implementing this therapeutic process known as trauma-focused CBT, the social work professional can then assess the strengths and the weaknesses related to the client. As we all know, clients are very different. So we need to see whether this is making an effective change within the therapeutic process. So in regards to the child's strengths, in regards to this process, children who participate in trauma-focused therapy can reveal an immense array of improvements after enduring these experiences. Improvements can include decreases in PTSD symptoms, behavioral issues, depression, anxiety, and so on. In regards to parents, because this isn't just applying to children, parents can also show improvements as well in areas such as reduced negative affect, reduce stressful emotions, reduce depressive symptoms, and so on. As Jessica stated, we go over the acronym known as PRACTICE. And in this acronym, the various components related to this protocol are deciphered and explained to the reader at hand. So as I stated previously, PTSD symptoms, depression, anxiety, and behavioral issues are also shown are the main improvements we want to see in the child to see if it's working or not, as every child is different. And that will tie into the weaknesses as we can assess. In the weaknesses section, we can assess whether the child is capable of receiving this therapeutic intervention. So in regards to weaknesses, as we know, there are various benefits. We also need to see if these benefits can be revealed in certain clients, as every client is different. As it is stated, trauma-focused CBT may not be appropriate for children who experience serious conduct and behavioral issues, as these can worsen them. These behavioral issues must exist prior to the traumatic incident occurring. So they could be experiencing problems in school, problems in the social environment, problems with friends, or even with their parents, even before they receive these therapeutic interventions. Another weaknesses or this process may not be applied to or be useful for is children who experience suicidal ideations, as these can worsen the symptoms related to these ideations. If you go into this process with children experiencing suicidal ideations or even substance abuse issues, they may have trouble with this exposure to this therapeutic process. As I stated before, these symptoms can be worsened. And basically, in regards to assessing the strengths and weaknesses, you can take that into account on whether your client is going to better receive from that. As we know, every client is unique. You need to see whether your client will benefit from this before going into this therapeutic intervention. As the main goal of CBT is to reduce PTSD symptoms among children and adolescents and basically make the negative situation as a whole a better one. If you know your client is not going to benefit from this situation, don't put them through it. You have to study your client before you go into that. And that is the benefit of studying strengths and weaknesses of this process.
Based on both clinical experience and research studies, many of the children who go through trauma-focused therapy with their parents show significant improvement in dealing with trauma symptoms and in their ability to lead a normal life. Once again, trauma-focused therapy centers around three core aspects. The first is strong parental involvement with both parent-only sessions and parent-child joint sessions. Second is the development of coping skills that help the child confront the trauma symptoms, emotions, and reminders related to the experience. Lastly, the retelling of the traumatic experience lets the child use these new coping skills and confront the traumatic experience in a safe and caring environment. It is here where the road to recovery truly begins.
My mom and I are closer now. My heart and my head don't hurt as much. I'm having more fun with my friends. Therapy is hard, but worth it. The best thing is that when my mom looks at me, I can see in her eyes that she knows I'm really doing better. You know, that feeling deep down. After all this, I know that my parents really, really love me. And best of all, my mom kept her promise. And that feels good.
She doesn't see herself as being an abused, traumatized person anymore. It doesn't define who she is. She is so many other things other than this child who was sexually abused.
You can make the world right again for a child who has been sexually abused. It might be a simple referral for a friend in need or a parent stepping up to protect their child. We won't tell you that it'll be easy, but we can tell you that it does work. Trauma-focused therapy under the supervision of a caring professional can not only change the way a young person sees the world, but also improve their chances in it. With knowledge, courage, and a determination to get effective help, you can make a huge difference in a child's life and help keep the promise that we as parents and the community have made to our young people. Thank you.
To reiterate what the video stated, our group does recommend that trauma-focused CBT be used for this population of sexually abused children. The National Child Traumatic Stress Network stated these myths regarding child sexual abuse. Myth: child sexual abuse is a rare experience. Fact: child sexual abuse is not rare. Retrospective research indicates that as many as 1 out of 4 girls and 1 out of 6 boys will experience some form of sexual abuse before the age of 18. However, because child sexual abuse is by its very nature secretive, many of these cases are never reported. Myth: children who are sexually abused will never recover. Fact: many children are quite resilient, and with a combination of effective counseling and support from their parents or caregivers, children can and do recover from such experiences. Myth: talking about sexual abuse with a child who has suffered such an experience will only make it worse. Fact: although children often choose not to talk about their abuse, there is no evidence that encouraging children to talk about sexual abuse will make them feel worse. On the contrary, treatment from a mental health professional can minimize the physical, emotional, and social problems of these children by allowing them to process their feelings and fears related to the abuse. Such statements simply reinforce our decision to recommend using trauma-focused CBT with a population of sexually abused children. It is vital when treating this population that parents and/or caregivers are involved, which is something that this specific treatment modality does through psychoeducation, teaching parenting skills, relaxation, affect identification and regulation, cognitive coping, trauma narration and processing, in vivo mastery, conjoint child-parent sessions, and enhancing safety and future development. In a multi-site randomized control trial for 229 sexually abused children conducted by Cohen in 2004, over 90% of these children had experienced multiple traumas with a mean of 3.6 different types of traumatic events. The study demonstrated that trauma-focused CBT was superior to child-centered supported therapy, which included limited interpretations and prompts to discuss sexual abuse-related topics, in improving children's PTSD, depression, behavior problems, and shame and abuse-related attributions, such as interpersonal trust. Parents receiving trauma-focused CBT showed greater improvement in depression, emotional distress about their children's abuse, support of the child, and effective parenting practices. In another study conducted by Cohen and Manariano, 2 parallel randomized controlled trials for 67 sexually abused preschoolers, 3 to 6 years old, and 82 children and young adolescents, 7 to 14 years old, comparing trauma-focused CBT to non-directive support therapy. The non-directive support therapy consisted of play for younger children and child or parent-directed supportive therapy for older children. The preschool study demonstrated the superiority of trauma-focused CBT in improving PTSD symptoms, including sexualized behaviors, and externalizing and internalizing behaviors. These differences were maintained over a 1-year follow-up. Again, these facts, the videos, the myths that we shared simply reinforce our decision to recommend that trauma-focused CBT be used for the population of sexually abused children. And now I'll turn the time over to Sheryll, who will provide the conclusion.
We've provided a bit of background about trauma-focused CBT. Jessica walked us through the therapeutic process using the acronym PRACTICE. Damon provided an analysis of the strengths and weaknesses of using trauma-focused CBT for children who have experienced sexual trauma, and Feryn provided a video of why trauma-focused CBT is useful for the population we selected, and went on to detail why we recommend its use. Thanks for joining us. We hope it's been useful.